Today I want to share a story that has deeply moved me, not just as a plastic surgeon, but as a human being. And it's the story of Jacqueline Durand, a young woman whose life changed forever in an instant, yet whose resilience and spirit continue to inspire me and countless others. On December 23, 2021, just a day before her 22nd birthday, Jacqueline Durand's face was nearly completely taken from her.
I was going to dog sit for a family, and as soon as I opened the front door, two of the three dogs attacked me.
Now, before this fateful day, she took all the necessary precautions. She had met the dogs, a mixed breed German Shepherd and a Pit Bull, prior to this visit, and she met with the family who owned the dogs, and really everything went without incident. The dogs were friendly, the family seemed nice, so she would have never expected what would happen next. Well, when she entered the home on the first day to dog sit, both dogs viciously attacked her the second she opened the door, causing catastrophic injuries to her face, arms, legs, and body. Jacqueline's ears, nose, cheeks, and lips were torn from her face right down to the bone, and many muscles in her face and jaw were damaged. She endured over 800 bites and was left permanently and catastrophically disfigured. Well, she told CBS News that the dogs grabbed her and dragged her from the front door into the living room, and she was afraid she was going to die. The only thing that saved her life was the fact that the front door was left open, triggering an automatic alarm that alerted police and emergency responders to check in. However, when they arrived, it took roughly 35 to 40 minutes to rescue her due to the aggressive nature of the dogs. Well, when a medic was finally able to get to her, Jacqueline was rushed to the hospital where she underwent multiple life-saving surgeries and was placed in a medically induced coma. And this lasted for a week.
She had to be resuscitated on the trauma table
multiple times.
Now, to understand Jacqueline and the impact her story truly carries, it's important to talk about who she was before this horrific attack that changed her life. Jacqueline's love of dogs began early. At age 11, she convinced her parents to adopt a golden retriever named Aspen. This was followed by another named Abby, and she absolutely loved dogs as a child, and that love continued on into adulthood. Well, this led her to start a dog sitting business while attending the University of Texas at Dallas. So you're probably wondering, what happened? Since she had met the dogs earlier and they didn't seem to be killers. The dogs could have been stressed from being left by their owners, and maybe they thought that Jacqueline was an intruder. Or honestly, there could have been any number of reasons. But the fact is that we just don't know why this happened. That being said, as a plastic surgeon who's repaired countless dog bites in the emergency room, it's important to always be cautious around dogs that you don't know well. Certain breeds are also known to be more potentially aggressive than others, like Pit Bulls, who comprise over 22% of dog bites per year. Rottweilers, German Shepherds, and Chihuahuas are also known to be more likely to bite people compared to other breeds. But that being said, I volunteer at a local dog rescue, and I've met and interacted with a lot of Pit Bulls who are gentle, and I'm not concerned would actually bite me. So I think it's really important not to demonize any specific breed as being dangerous, because it's their upbringing, their environment, and so many other factors that are likely to be more important than their specific breed and how likely they are to bite. In fact, even after her horrific injuries, Jacqueline hasn't changed her mind about dogs.
I was thinking dog training, because that's...
Dog training?
Yes. That's my dream.
Well, Jacqueline's recovery has been nothing short of extraordinary. Let's briefly go over some of the reconstruction that she's undergone. Immediately after the injuries, the goal is to stabilize her health and prevent future damage to her facial structures. So typically, other than suturing whatever tissue remains of her face back together, the reconstruction doesn't begin until her health has been completely stabilized. So in the immediate aftermath of her injuries, the plastic surgeon most likely applied skin grafts to cover any of the exposed muscles or fat of her face to prevent them from being further damaged by exposure. Now, in order to reconstruct her nose, Jacqueline appears to have undergone a forehead flap to rebuild the soft tissues of the nose. And this is when skin and the underlying fat is taken from the forehead and rotated downward. Now, underneath the new nose, her plastic surgeon likely placed cartilage grafts from her ribs in order to reconstruct the actual framework of the nose. Now, you can also see in many of her videos that her lower eyelids are being pulled downward. This is called an ectropion, and this pulling is likely due to the loss of her cheek tissues. In order to treat this, her cheeks will need to be reconstructed, and this is important because ectropion can cause dry eye problems and even lead to vision problems if not corrected. While her upper lip is where you may see some of the biggest changes. It appears that her plastic surgeon used a free flap to reconstruct it. They probably removed skin and fat from another part of the body, like the forearm or the lower abdomen, and used it to reconstruct her upper lip. Now, in order to do this, you have to suture the tiny blood vessels from the donor to the recipient site together, and this is to allow that flap to heal into a new place. After it fully heals, then you can go back to it and slowly debulk it, or basically remove excess skin and fat. And this is in order to contour it better and to make it look more natural. And Jacqueline also lost her ears. Now, instead of trying to remake them surgically using cartilage and skin, they're usually best reconstructed using prosthetics. And these are going to look much more natural and real than a reconstructed ear would. The surgeon will need to place actual posts though to support those prosthetic ears, and this must be done surgically. What skincare ingredient is touted by the vast majority of plastic surgeons and dermatologists as the best to get smoother, younger looking skin? The answer is retinol. And our Youn Beauty Retinol Moisturizer is the cornerstone for our youth promoting skincare regimen. Like all Youn Beauty products, it's fragrance-free, cruelty-free, and free of potentially harmful ingredients. To check out the Retinol Moisturizer and all the Youn Beauty skincare products, go to younbeauty.com or click the link in the caption below. She's also undergone years worth of physical therapy, which has been crucial, with efforts to stretch her mouth 1 millimeter at a time. And we have to remember that these surgeries are not just about appearance, but they're about restoring essential functions like eating, speaking, and hearing. But despite the pain and the challenges, Jacqueline remains optimistic, crediting her medical team for their incredible work.
It's not fun to think about, but I also think about how amazing the doctors are.
Despite the trauma, Jacqueline chose to face the world head on. She began documenting her recovery journey on social media, sharing both the challenges and the triumphs. Her TikTok videos, Instagram, and YouTube channel offer a candid look into her life post-attack, aiming to inspire others facing adversity. Now, I reached out to Jacqueline to see how she was doing and what message she wanted to share with the public. And this is now that she is a few years out of that tragic night in December. So how are you doing, Jacqueline?
I'm doing well. I just had my 20th surgery about a month ago, and it was pretty extensive. So I'm really grateful for the way I've been able to heal and just getting through it.
What was the 28th surgery, the last one that you had?
So I had, in the surgery before, I had tissue expanders put in my cheek and my neck so that they could move the skin over to my cheek and kind of create the symmetry on my face, as well as put actual facial tissue back on that side of my face. And then I also got my eye stitch to move upward, so my eyelid is more on my eye, so it doesn't droop as much. They also did some nose work that is going to help them kind of recreate the foundation of my nose.
What surgeries do your doctors tell you that you still have left in the future?
I definitely am going to get started on basically completely reconstructing my nose. Eventually, I'll need to get tissue expanders on my forehead, recreate the nose, take some more red cartilage, kind of just build inside of my nose as well, and like reshape it. Probably some more tweaks on my eyes. For sure, working on my bottom lip to kind of lift it up higher, getting more facial skin put on here.
How have your feelings for dogs in general changed since this incident several years ago?
I still have a special spot for dogs. I think I am a lot more aware of the breed, the size, the temperament. I definitely don't feel like I can live without a dog. I have a service dog of my own, and I lost my 2 original dogs last year, so it's just been bittersweet to have a dog throughout this journey. And because I guess I had my dogs throughout the journey, I can't do without them, and so and to even mentally heal, I need a dog.
I hear you. I've got 2 dogs of my own, both rescue dogs. And I was telling my wife last night that I don't think we can live without having a dog. Now that it's been almost 3.5 years, how do you feel like this incident has changed the way you look at the world itself and just overall living life?
I think I notice a lot more judgment in the world. I think people are very constantly wanting to either praise you for how strong you are, or it's kind of like one end or the other of the spectrum. They're very kind, or they're very rude and ugly about it. And so I feel like kind of being the bigger person and ignoring that and thinking maybe they're going through something and they're just taking it out on the wrong people. So it's just kind of one of those things where I feel like the judgment of the world is more obvious. It makes me sad that people are like that, but the people who are supportive are my community and my family.
So you've had people who have been less than kind. Is it just about your appearance, or is it something else?
It's mostly my appearance, yeah.
What message do you have for the people who are watching this?
I would say whatever you're going through, don't feel like you're alone. We're all going through something, whether it's more minor and more severe than someone else. Your struggles don't go unnoticed, and don't feel like you're less than someone just because you have it a little bit better than someone else.
Well, I think I speak for all of us when I say that you're a true inspiration. Obviously, you've been through so much more than any of us could ever really imagine. But for you to present yourself to the world as you are is really a breath of fresh air. And I want to commend you for your strength and your resilience. And you really, I think, trying to bring good things into obviously a tragic situation.
Thank you so much. I appreciate your kind words.
Well, as a plastic surgeon, I'm continually amazed by the resilience of the human body and the spirit. Jacqueline's journey underscores the importance of comprehensive care, physical, emotional, and psychological, that are so important in the healing process. Her story also serves as a reminder of the responsibilities that come with pet ownership and the need for clear communication with caregivers. Well, a GoFundMe campaign has been set up to assist with Jacqueline's ongoing medical expenses, therapies, and other needs related to her recovery. So if you're moved by Jacqueline's story like I am and you want to contribute to her, you can find a link in the caption below. I really want to thank Jacqueline for sharing her story not only with me, but with the whole world. Jacqueline, you are truly an inspiration for all of us, and I am honestly so impressed with your strength. So everybody, please take a look at her GoFundMe. If you even have just a few dollars to contribute, any small amount of help definitely means a lot. Thank you so much for watching. As always, remember to eat real food, use clean skincare, and auto-rejuvenate before you operate.